Am I audible? Is my screen visible? Is my voice breaking? So ketogenic diet for diabetic people, it reverses their insulin resistance. More mitochondria will begin to to be produced in the cells. More mitochondria means more energy, more fat loss, okay, increased basal metabolic rate. Weight reduction, you lose your appetite, okay, uh, and formation of adipose tissues will also go down, lipogenesis, and whatever fat is already present in your body, that will begin to be broken down. Gluconeogenesis, okay, that will increase, that is new glucose being produced, and that will keep your body warm as well. So that happens for weight reduction because of ketogenic diet. Then cardiovascular risk parameters, your LDL particles, okay, that increases, the blood flow increases. Your insulin sensitivity, that will also be there. Your cells will start responding to insulin, and the blood insulin level also increases to control the glucose spike. Then kids who have epilepsy, the neurotransmitter activity calms down, okay, because the ketone bodies, they have an anticonvulsant effect. Ketone bodies are produced as a part of ketogenic diet, okay, that ketone bodies have an anticonvulsant effect, and your neurons are not excited unnecessarily. When the neurons get excited unnecessarily, that's when epilepsy happens. mTOR pathway and all, that is biochemistry, you don't have to know much about it. So that's how ketogenic diets work. Okay, too much of fat uh, digestion will produce a lot of ketone bodies, and that will correct the epilepsy. That was a therapeutic benefit of ketogenic diet. Okay, but weight loss was a side effect of it. So it became, the marketing pointed out weight loss more than the epilepsy part. Then you have paleo diet. Okay, paleo diet in its purest form allows you to eat only those foods that your human ancestors ate millions of years ago. Okay, when they were roaming the planet, when they were hunter gatherers, at that time, what kind of food they were eating, that is what in paleo diet people eat. Okay, high fat food, processed food, okay, that will be completely eliminated from your diet. Okay, these foods don't have enough nutritional values and they have too many calories. It will be completely eliminated from your diet. So these are the things that you're supposed to eat in paleo diet. On the left, you can see fresh fruits, vegetables, okay, berries, citrus fruits, nuts, eggs, poultry meat, wild meat, okay, and wild hunted boar meat and all, okay, coconut oil, olive oil. These are the oils supposed to be used. Things that don't fall under paleo diet, anything that is packaged, processed, sugar, candy, fruit juices, grains, because those times and all you didn't had cereals and millets, okay, because farming hadn't started. Okay, your human ancestors, when they were hunter gatherers, they didn't farm. Agriculture was not a concept then. Okay, so the cereals and millets, they were a product of farming, they were a product of agriculture. Okay, So that came much later into human history. So grains, bread, millets, genetically modified food and all will not be a part of paleo diet. Okay, extracted seed oils, dairy products. Okay, because it was through when ancient humans understood milk, they started using milk. That's when they settled at one place. Until then, they were roaming, okay, roaming through the jungles and forests, and okay, they were always migrating. The hunter-gatherer tribes and all. But once they understood farming, and once they understood that milk from cattle can be used for their food purposes, they settled at one place and agriculture began, civilizations began. Okay. So dairy will not be a part of paleo diet. Then kids who are born with normal palate, cleft palate, bilateral cleft lip or bilateral cleft palate. Okay, this happens during pregnancy if the mother is deficient in folic acid, especially folic acid. Okay, during the first trimester, neural tube will not close properly. If the child should have a proper skull closure, proper spine, okay, proper facial symmetry, neural tube has to close properly when she is pregnant, and this closure takes place in the first trimester. And during the first trimester, if she is not taking the folic acid tablets and all, and she is deficient in folic acid, usually a child with this anomaly is born. Cleft lip, cleft palate is born. Okay. It's very difficult for these children to suck on to the mother's nipples, okay, because the upper lip is not completely full. Okay, it is not creating a proper grasp. Okay, it does not, the cleft lip will not support a proper grasp. Okay, so feeding these children directly from the breast for breastfeeding, it is difficult. Okay, so pallida feeding has to be done, or special bottles are available. Okay, like this, these are the cleft lip bottles available for babies. So directly they just have to swallow. In some kids, swallowing is also a difficult situation. Okay, they aspirate a lot. So it's always ensured that mother should hold the baby at 45-degree angle so that through gravity, the milk will go into the esophagus, into the stomach. It will not regurgitate back. Okay. So these are the special bottles, feeding bottles available for cleft lip and cleft palate babies. Okay. There are other situations like diet for kids who are autistic and all. Usually it's preferred that whoever is consulting these kids, the caregivers and the consulting um, psychologists and counselors for these kids are involved in what kind of food has to be given to autistic children, because they are very selective. Autistic kids and all, they are very selective. Okay, and it's difficult for these children to have a family meal together because everyone will be talking. They are very sensitive to crowded space, very sensitive to loud noises. Okay, that could be very chaotic for autistic kids. So, a calm, silent place where only one caregiver is present, whom the child trusts properly. Okay. And they first, go through a lot of feeding problems. Okay. The parents go through a lot of feeding problems with autistic spectrum kids. And they are very particular about texture, taste, smell. Okay, and every day they want a specific kind of food, and you have to follow that. Their meal requirements are very rigid, and if you don't give them what they want, they will cry, they will create a chaotic situation. Okay, because they don't understand emotional intelligence. Okay, these kids, the mind and body are work separately. They don't understand the emotional intelligence much. Okay, aggression towards caregivers could be there. So that is about autistic kids.